situation. So I will introduce my prevention strategy by using a one band while standing. First, let's do deep shoulder muscle activation. With a less steeper band, let the shoulders start with the internal rotation and end with the external rotation. Do this at least 10 times. Don't bend your wrist while you are doing this exercise. Second, this is for trunk rotation mobility and strength. You can widely increase the range of rotation of the thoracic step by step, and this will strengthen the power of rotation. Third, shoulder internal rotation versus external rotation. The power of internal and external should be equally the same. No one of them should be stronger than opposite. During the flexion and abduction of the shoulder, the internal and external rotation should be more rapidly at the same time. You are shaking at the bend. When the shoulder is in external rotated position at the end, on the way back, like the lower arm, return to start position slowly. Fourth, front arm line versus back arm line. The balance between the front and back arm line is important. Archers tend to have a shorter front arm line. Start with eccentric stretch of the front arm line while lowering your arms horizontally from the height of your head with your arms straight. Lean forward and eccentric stretch your back line with one hand pushing toward to the opposite foot and one hand pushing over toward the ceiling. Fifth, upper arm line versus lower arm line. Archers tend to shorten of the upper arm line associated overuse and shoulder elevation. Spread the band outward with the standing position. Let the feet place narrow each other. The shoulder is raised toward to your ears while feeling the contraction of upper trapezius and triceps. And then return slowly with keeping the tricep contraction. Start with your leg widely, stretch your arm and push them out of the bend. Bend your trunk sideways, rotate your thoracic spine, and push your fingertips far away from each other. Then you can feel the lower arm line stretching. This exercise is the best way to prevent the injury mechanism I have mentioned earlier. Lastly, sports-specific training. It's an exercise to transmit ground reaction force to the upper body with one leg standing. Transferring ground force of the lower body to the upper body can reduce loading of the shoulder for archers. Exercise sequences are important. Both arms pull with the bend. Lift the heel first, then move the weight to the opposite foot, and lifting forefoot carefully. Bend your knee in 90 degrees, move the band back and forward. In this exercise, you should hold your band really tightly. This exercise of drawing the bow is an exercise that finishes and summarizes that all of exercises we have done so far. Hold the band between the second and third finger to enhance to grip power. The pronation of the forearm will be more activate the shoulder blade. Last step, assess effectiveness of strategy. So far, no research has been done to determine the effectiveness of an injury prevention program for archers. Therefore, further research is needed. In addition, research on the prevalence of archery is required. For this study, we need collaboration of World Archery, the Medical Science Division, and the IOC research centers. We have looked at all of the IOC chosen strategy for injury prevention. I'll explain two more things to prevent archery injury. It's about loading and screening. Loading management is important to prevent injury. Therefore, we have done a pilot study to find a relationship between the bow drawing force and maximal strength. The individual maximum strength was measured isometrically in the bow position using isokinetic equipment. As a result, male archers had a drawing force ratio of 52.8% compared to their strength. In comparison, female archers was 65.4%. If we can collaborate with other NOC, we believe we can provide guidelines for safe green zone, warning yellow zone, and dangerous red zones. In order to create most similar environment to archery situation, we can use the dynamometer directly on the bow to do like this following video. The maximum muscle strength is calculated by adding the actual pound of the individual bow and the result of the dynamometer. This screening test is performed as preventive measure to detect a potential injury in case of archers of non-symptoms but clear sign of injury. I would like to introduce two tests that relate to archery movement. The first is the modified Viewcom test. It's to check if there is discomfort and pain in the movement of the shoulder during the drawing and anchoring position. If there is no pain through this test, it is determined that there is no problem with the shoulder tendon. However, this is not a full determinant of the shoulder problem. To make sure, we advise to take an additional examination if necessary. Second, bow loading test. The bow arm side must have enough muscle strength to maintain the posture without causing any pain while lifting the bow. In addition, the draw arm side must have at least a drawing pound of muscle strength to maintain the posture without causing any pain in the anchoring position. The purpose of these two screening is early detection of injury. It helps to reduce the risk of injury or help you find the condition that can be treated more effectively. Therefore, it is recommended to use it regularly before start training. It's a summary. GESET is aimed to preventing sports injury. In the future, continuous research is needed to update the archery part. The exercise methods provide video in all levels of variations, and it's easy to apply in any situation. Most importantly, GESET is based on IOC Medical Commission evidence-based experience. So it will give you a powerful motivation for archers and coaches. These are references. Thank you very much.